Hi everyone, I'm Kelsee Zajac and I'm a second-year medical student at the University of Toledo College of Medicine and Life Sciences, and I'm going to talk to you today about early exposure to LGBTQ plus medicine, assessing confidence and comfort in preclinical medical students. Sexual and gender minority populations, and while really any minority in general, encounter microaggressions and disparities in everyday life, but also particularly in healthcare. Physicians play a major role in addressing these health inequities, and without proper education and training, these discriminations can be further perpetuated. For example, a survey was sent out to members of the LGBTQ+ community in Colorado, and 65% of LGBT respondents said that they felt that there were not enough adequately trained and competent healthcare professionals. With the increasing LGBTQ+ population, this should be reflected within the medical school curriculum by increased educational initiatives. Early exposure and practice for preclinical medical students allows for the maturation of proper clinical skills that can help develop more competent and compassionate physicians, starting with trainings in their preclinical years. The University of Toledo's College of Medicine's LGBTQ+ organization called People in Healthcare implemented a workshop focused on LGBTQ+ clinical health scenarios with preclinical medical students. The first hour was a lecture on sexual and gender minority clinical medicine from a guest physician who specializes in these topics. The second hour included case scenarios ranging from healthcare scenarios to day-to-day dilemmas sexual and gender minority people face every day, a seminar on gender-affirming care, and an individual patient simulation, all followed by debriefing. The purpose of this workshop was to evaluate preclinical medical students' confidence and comfort before and after an educational LGBTQ+ clinical workshop. A survey was offered to students pre- and post-workshop with basic yes or no questions and questions assessing confidence on a scale of extremely uncomfortable to extremely comfortable. One of the first metrics we looked at was any prior training with LGBTQ+ individuals in healthcare. The majority of respondents never have worked with LGBTQ+ patients, and roughly half of the respondents reported never receiving any instruction for working with LGBTQ+ patients. When asked to rank, I feel competent utilizing proper LGBTQ+ terminology in healthcare practice, we can see in the pre-survey a range of answers with roughly one-third of respondents in the somewhat uncomfortable zone. Post-workshop, the data trended more so in the comfortable realm. When asked, I feel competent in the basics of gender-affirming care. Again, we see a wide distribution of answers in the pre-survey. Comparing it to the post-survey results, we have no one that responded in any of the uncomfortable categories. And for the last data point, when asked, I am comfortable eliciting a sexual history from an LGBTQ+ patient, the majority of respondents responding feeling neutral. This was one of the main points hit during the individual patient simulation, and afterwards the post-survey showed a shift towards feeling comfortable. Educational opportunities to practice with LGBTQ+ patients during preclinical years increases medical student confidence and comfort with patients. A lecture followed by an interactive experience provides an efficient modality for proper education and clinical skill development. This workshop can be easily employed into a current medical school curriculum to help create competent and compassionate physicians. And a final note from the survey is that every participant responded that this style of workshop would be beneficial to any healthcare-related degree. And that's it. Thank you for listening to my talk on LGBTQ healthcare.